Thank you, Chairs, Professor Kyoko, and the chairs for the very kind invitation for me to speak on the topic pathogenesis of myopic choroidal neovascularizations. Pathological myopia is a leading cause of visual impairment, and myopic CNV is one of the most common complications in pathological myopia, causing the central visual loss. And Professor Kyoko Onomatsui has led a group to evolve the meta-pathological myopia classification from the myopia maculopathy from no lesion to tessellated fundus to diffuse chorioretinal atrophy, patchy chorioretinal atrophy, and macular atrophy. And also there's a plus lesion including the lacrimal cracks, the choroidal neovascularization and field spots, and also staphyloma is another very important feature for the pathological myopia. In the ATN classification, the neovascular myopic maculopathy is mainly referred to the myopic CNV. And myopic CNV prevalence occur in pathological myopia is about 5% in the United States and 11.3% in Japan. And if we have one eye myopic CNV, and the risk of fellow eye having the myopic CNV is about 35% within 8 years. And if untreated properly, the irreversible severe visual loss will occur in 5 to 10 years. There are three main stages of myopic CNV, from active with some subretinal hemorrhages and to the scarring stage, that is the field spot, and also the atrophic CNV, all are associated with vision impairment. Myopic CNV diagnosis could be by symptoms, by fundoscopy, fluorescent angiography, OCT, and the OCTA. Timely and appropriate management of the myopic CNV is very crucial because, and also unraveling the etiology and predisposing factor for the myopic CNV is also important to develop precautious measure and proposing treatment option. Mechanical hemodynamic heterodegenerative theories have been proposed. However, the precise pathogenesis of myopic CNV remain unclear. We have conducted a meta-analysis of the literature to look into the pathogenesis of the myopic CNV, and today I wish to share some of the results based on this meta-analysis with you all. And so we include 50 studies with a total of 14,000 eyes, including about 35% with myopic CNV, and the other 16.5% cases with no myopic CNV as a control. So among these case and control, we evaluate the outcome, including different outcome, including the structural factors, the hemodynamic changes in choroidal circulation, the genetic factors, and the systematic predisposing factors. The lacrimal cracks are sharply outlined defects of the retinal pigment epithelium, branch membrane choriocapillaris complex with normal overlying neurosensory retina. And in fact, myopic CNV had a higher proportion. The odd ratio is 2.8 with the lacrimal cracks. And the patchy chorioretinal atrophy is a complete atrophy of the RPE and choriocapillaries, appearing as a grayish white well-defined lesion. And the myopic CNV again had a higher proportion of the patchy chorioretinal atrophy with the OR 3.5. For the posterior staphyloma, again, the average height of the posterior staphyloma for those with myopic CNV are much greater. The mean difference is 82 micron higher comparing to those without myopic CNV. In fact, the mechanical factor predisposing these pathogenesis, the lacrimal crack can trigger the wound healing mechanism leading to the myopic CNV, and also it also creates a space allowing for the neovascularization, and also the fibroblasts and inflammatory cell can migrate from the choroid to the subretinal space. For the patchy chorioretinal atrophy, also there is at the edge there can be a damage that may trigger the CNV, and also the posterior staphyloma is a key for the choroidal thinning. And the choroidal thinning will elaborate more on the pathogenesis. And the hemodynamic changes, there's two factors that can contribute to this the pathogenesis. One is the choroidal filling delay. Two studies have found a higher resistivity index and decreased blood flow in the posterior ciliary artery in eyes with myopia CMV compared to the non-CMV eyes. And the choroidal filling delay was a predisposing factor with the odds ratio 42 comparing to the control group. And another very key important factor is the choroidal thinning. And the choroidal thickness in the myopia CMV eyes is significantly thinner than the control group, with a mean difference 50 micron thinner. And also the perforating scleral vessel could be also related. A field report has mentioned that PSV were detected in area of myopia CMV in over 70% of the subject, and two studies has reported that PSV and myopia CMV can be continuous through the defect of the brush membrane, suggesting that myopia CMV can originate from a deeply situated scleral vessel. And for those cases which with PSV can show a higher rate of activity and need a poorer response to the anti-VEGF injection from that. Here show different relationship between the PSV and also the CMV. Some are fitting into the CMV, some are connecting, and some are passing underneath the CMV. So when there is a choroidal filling delay, in fact it can cause outer retinal hypoxia, and which can induce the VEGF upregulation causing the CMV formation. And also the choroidal watershed zone is one of the factors causing the choroidal filling delay, and again these are also leading to the hypoxia causing the myopia CMV. Choroidal thinning is also one of the potential cause of causing the retinal hypoxia, which induce the VEGF secretion and also the CMV formation. And the previous mechanical lesion, such as the lacrimal crack and also the posterior staphylomas, are also causes for the choroidal thinning, which induce all this hypoxia mechanism. And the genetic factor is also related, has been identified that the CFI gene in the SNPs can also be linked to the myopia CMV in Caucasian. Another COL8A1 gene is also associated with the myopia CMV in Caucasian. And the VEGF gene is also associated with the CMV size in Japanese. And some non-coding RNA genes has been also been associated with the CMV development while different signaling pathway. The systematic predisposing factors, including the VEGF and interleukin-8 and also other inflammatory factors, has been reported to be higher in the concentration and in the level in the aqueous humor in those myopia CMV eyes comparing to those eyes with high myopia but no CMV. These again can also be related to the theory for the mechanical stretching theory, because the elevated level of the VEGF may trigger proliferation of the vascular endothelial cells and growth factors, and which induce the CMV. And also the hypoxia can also leading to these VEGF dysregulation. And the VEGF overproduction can lead to the CMV. So in summary, in our meta-analysis, in a group of patient with a myopia CMV and a group of patient with highly myopia without myopia CMV, what this meta-analysis from the literature found is there's a higher ratio of the lacrimal cracks and patchy chorioretinal atrophy, and the posterior staphyloma in those myopia CMV are greater height, and there is a thinner choroidal thickness, and also there is a higher level of the VEGF and interleukin-8 in the aqueous humor, and also there is other structural predisposing lesion, including the hemodynamic factors, gene polymorphism, and systematic factors were also involved in the pathogenesis of the myopia CMV. So I would like to once again invite you all to the coming third Congress of Asia Pacific Strabismus and Pediatric Ophthalmology Society, which will be held on June 29 to July 1st in the Brisbane Convention Center in the Brisbane, inviting you all to join this conference, and also looking very much warmest invitation and welcome to you all to attend the APAO 2026, which will be held in Hong Kong in February 5th to 8th. It will be a time which is very near Chinese New Year, the Lunar New Year. When you come to Hong Kong, you will have a full atmosphere of the very festival season, and I'm I promise you an unforgettable stay in Hong Kong. We will try our best to host you, everyone, to come to Hong Kong. Thank you very much.
Jason, thank you so much. Any questions? Jason, it is a very interesting. Your theory is highly structured. And I'm also thinking about inflammation, the role of inflammation, as you showed IL-8. And some lesions like cracks and patchy atrophy sometimes originated from peak punctured in a choroiditis. So I think maybe among myopic CNV, some kind of peak CNV may be involved. So maybe the role of inflammation may be higher than we thought. Have you experienced any patients with peak OCT, peak CNV?
I have very little experience, but I'm looking forward to learn from Kyoko, Professor Kyoko. And in fact, for these cases, especially, I think the choroidal thinning, especially I understand they are using now the red light therapy for all these choroidal circulation. Do you feel that it is really hitting on the choroidal thinning mechanism so that it can prevent the myopic CNV in these cases?
Yeah, could you say it once again? Sorry.
So because we understand that there is an inflammatory marker, there is choroidal circulation markers, there is some structural markers. So the hypoxia and also the inflammatory is also one of the key drive for all these mechanisms. I'm just asking your opinion on the using of some circulatory treatment that can improve the circulation, including the red light therapy. Is it helping to translate or prevent all these damage?
Yeah, that would also be possible. And actually, we had a research on highly myopic adults to see if the red light therapy on adults can increase choroidal thickness. Because in addition to neovascularization, for atrophy, we don't have any treatments right now. So if we can maintain choroidal thickness, I think it would be beneficial for them.
Thank you. Thank you.
Very nice presentation.
One question, please.
Yeah.
Sir, how do you follow these patients? How do you treat or manage this kind of patients?
For the myopic CNV?
Yeah.
Of course, the treatment, I have to declare that I'm not a vitreoretinal surgeon. I'm a pediatric ophthalmologist, but we have done a meta-analysis. For all these treatment cases, I will be managing this with my vitreoretinal colleague, which will do the VEGF injection for all these myopic CNV.
Yeah, once again, a very nice presentation on the meta-analysis of various risk factors for myopic CNVM. I just wanted to check if you also looked at the recurrence of myopic CNVM. The recurrence rates of myopic CNVM, because traditionally we know that myopic CNVMs require less number of injections compared to, let's say, macular degeneration.
Right.
However, in our study we have seen about 30% recurrence rate, while in the first and second year there may not be as much recurrence as macular degeneration, but over a period of time almost 30% had recurrence, and some of these eyes do really bad. So was seeing if you also looked in your meta-analysis predictions for recurrent CNV.
Yes, it's very important that for those recurrence and the factor inducing all this recurrence is important. But in our study, because it's a meta-analysis, we're just looking into those who are diagnosed with the CNV and those without CNV, and then we look into their underlying differences in terms of the number of those who are lecrocrat, number of those of the other features, and then to analyze. We don't have the data to analyze, allowing us to analyze the recurrence rate. It is very unfortunately, but all these recurrence cases and the factor is also very important.